Did you know that some of the medications you take every day could be harming your kidneys without you even realizing it? Your kidneys play a vital role in filtering waste and toxins, maintaining fluid balance, and supporting overall health. Yet, certain drugs, some of which might be in your medicine cabinet right now, can put these crucial organs under immense stress. In this video, we'll uncover 7 common medications that could damage your kidneys, explain how they affect your health, and offer safer alternatives or precautions to consider. Whether you're dealing with chronic pain, high blood pressure, or other health conditions, knowing how these medications impact your kidneys is essential. Stay tuned, because this information could make all the difference in protecting your kidney health and preventing long-term damage. Your kidneys are silent powerhouses that work around the clock to keep your body functioning smoothly. These 2 bean-shaped organs filter about 50 gallons of blood each day, removing waste products, excess fluids, and toxins through urine. They also balance electrolytes like sodium and potassium, regulate blood pressure, and even produce hormones that control red blood cell production and strengthen bones. In short, your kidneys are essential to maintaining your overall health and well-being. However, these vital organs are not immune to damage, and one of the most common culprits is medications. While drugs can effectively treat various health conditions, some can have unintended side effects on your kidneys. Prolonged or improper use of certain medications can overwhelm the kidneys, impairing their ability to filter toxins and regulate the body's internal balance. This can lead to a host of problems, including chronic kidney disease, CKD, which affects millions of people worldwide, or even acute kidney injury, a sudden decline in kidney function that can be life-threatening. The risk is particularly high for individuals who already have underlying kidney issues, diabetes, high blood pressure, or other conditions that compromise kidney health. Medications that are nephrotoxic, toxic to the kidneys, can exacerbate these problems, increasing the likelihood of long-term damage or kidney failure. Even people with healthy kidneys can experience issues if they take certain medications in high doses, over long periods, or without proper hydration. Understanding how medications affect your kidneys is the first step in protecting them. By learning about which drugs pose a risk and how to mitigate their impact, you can make informed choices to safeguard your kidney health. Whether it's consulting with your doctor, monitoring kidney function through regular tests, or exploring safer alternatives, being proactive can help prevent complications down the road. Protecting your kidneys isn't just about avoiding problems. It's about preserving a foundation of good health for years to come. Non-steroidal anti-inflammatory drugs, NSAIDs, like ibuprofen, naproxen, and aspirin are some of the most commonly used medications worldwide. They are effective at reducing pain, inflammation, and fever, making them a go-to choice for everything from headaches to chronic conditions like arthritis. However, while NSAIDs offer quick relief, they can have a significant downside. They pose a risk to kidney health, especially when used frequently, in high doses, or over an extended period. NSAIDs work by blocking enzymes called COX-1 and COX-2, which are involved in the production of prostaglandins, hormone-like substances that play a role in pain and inflammation. However, prostaglandins also help maintain blood flow to the kidneys. By inhibiting these enzymes, NSAIDs can reduce blood flow to the kidneys, decreasing their ability to filter waste and maintain fluid balance. This can lead to acute kidney injury, a condition characterized by a sudden loss of kidney function. For people with pre-existing kidney conditions, diabetes, high blood pressure, or heart disease, the risks are even greater. In these individuals, the kidneys may already be under strain, and the reduced blood flow caused by NSAIDs can exacerbate the problem, potentially leading to chronic kidney damage or worsening existing kidney disease. Older adults are also at higher risk, as kidney function naturally declines with age, making them more vulnerable to the nephrotoxic effects of NSAIDs. Even individuals with healthy kidneys are not immune to the risks. Prolonged use of NSAIDs or taking them without adequate hydration can increase the likelihood of kidney problems. Dehydration is particularly dangerous, as it further reduces blood flow to the kidneys, amplifying the harmful effects of NSAIDs. To minimize the risk, it's essential to use NSAIDs cautiously. Avoid taking them on an empty stomach, stay hydrated, and follow the recommended dosages on the packaging. For those with kidney concerns, safer pain management options may include acetaminophen, paracetamol, which does not have the same impact on kidney blood flow. However, even acetaminophen should be used under medical guidance, as it can pose risks to the liver if overused. Non-pharmacological pain relief methods can also be effective. Physical therapy, heat or cold packs, and relaxation techniques like meditation or yoga can help manage pain without the need for medication. Always consult a healthcare provider before starting or stopping any medication, especially if you have a history of kidney issues. While NSAIDs can be a helpful tool for managing pain, their potential impact on kidney health should not be overlooked. Being mindful of how and when you use these drugs can go a long way in protecting your kidneys and ensuring they continue to function optimally. If you rely on NSAIDs regularly, talk to your doctor about safer alternatives or strategies to minimize their impact on your health. Antibiotics are life-saving medications that fight bacterial infections, but not all antibiotics are created equal when it comes to their impact on kidney health. Certain antibiotics, particularly those in the aminoglycoside class, like gentamicin and tobramycin, have been linked to nephrotoxicity, damage to the kidneys caused by toxic substances. This damage can impair the kidney's ability to filter waste, balance electrolytes, and regulate fluids, leading to serious health complications. Aminoglycosides are powerful antibiotics, often reserved for severe infections, such as pneumonia or infections caused by drug-resistant bacteria. However, their effectiveness comes with a price. They can accumulate in kidney cells, where they generate oxidative stress and damage the delicate structures of the renal tubules. This can result in acute kidney injury, AKI, particularly when these drugs are used in high doses, over prolonged periods, or in individuals with pre-existing kidney issues. Other antibiotics, such as vancomycin, used for treating MRSA infections, and certain beta-lactam antibiotics, can also pose risks to kidney health. These drugs may lead to kidney inflammation, allergic reactions, or interstitial nephritis, a condition where the kidney's filtering structures become swollen and less effective. Improper use of antibiotics significantly increases the risk of kidney damage. Taking antibiotics unnecessarily, not completing the prescribed course, or using them without a healthcare provider's guidance can strain the kidneys. For instance, self-medicating with leftover antibiotics might expose the kidneys to unnecessary stress without effectively treating the infection, compounding the risk. Hydration plays a crucial role in reducing the nephrotoxic effects of antibiotics. Drinking plenty of water ensures the kidneys are well flushed, helping to dilute and excrete these drugs efficiently. This is particularly important for individuals on high-risk antibiotics or those with existing kidney concerns. Staying hydrated can also prevent dehydration, which increases the concentration of drugs in the bloodstream and intensifies their impact on the kidneys. To minimize risks, follow these tips for safer antibiotic use. Stick to prescribed dosages. Always take antibiotics as directed by your doctor. Do not skip doses or stop the medication early, even if you start feeling better. Avoid self-medication. Only use antibiotics that have been prescribed specifically for you and your condition. Using someone else's prescription can lead to improper dosing and unnecessary kidney strain. Monitor kidney function. If you require long-term antibiotic use, especially aminoglycosides or vancomycin, your doctor may conduct regular blood tests to monitor kidney function. Be sure to report any symptoms of kidney problems, such as decreased urination, swelling, or fatigue. Hydrate adequately. Drink plenty of water while taking antibiotics to help flush the kidneys and reduce the risk of nephrotoxicity. Consider alternatives. In some cases, your healthcare provider may suggest alternative antibiotics with lower nephrotoxic potential. Always discuss your medical history, especially kidney-related conditions, with your doctor before starting antibiotics. While antibiotics are essential for treating infections, their potential impact on kidney health highlights the importance of using them responsibly. By sticking to prescribed treatments, staying hydrated, and being vigilant about kidney health, you can protect these vital organs while benefiting from the life-saving power of antibiotics. Always consult your healthcare provider if you have concerns about the medications you're taking or their effects on your kidneys. Proton pump inhibitors, PPIs, such as omeprazole, Prilosec, and esomeprazole, Nexium, are widely used medications for managing acid reflux, heartburn, and conditions like gastroesophageal reflux disease, GERD. While effective in reducing stomach acid production, emerging research has raised concerns about their potential link to kidney damage, particularly when used long-term. PPIs work by blocking the proton pumps in the stomach lining that produce acid. While this provides relief for acid reflux and protects against stomach ulcers, studies have shown that prolonged PPI use may have unintended consequences for kidney health. One significant concern is their association with chronic kidney disease, CKD, and acute kidney injury, AKI. Research has revealed that long-term PPI use can impair kidney function by causing interstitial nephritis, a condition where the kidney's filtering structures become inflamed. This condition may occur without noticeable symptoms, leading to silent and progressive kidney damage over time. In some cases, this inflammation can lead to permanent scarring, reducing the kidney's ability to filter waste effectively. A large-scale study, published in JAMA Internal Medicine, found that individuals using PPIs had a higher risk of developing CKD compared to those using other acid-reducing medications, such as A2 blockers, EG, ranitidine, or famotidine. Furthermore, the risk of CKD appeared to increase with prolonged PPI use, underscoring the importance of limiting these medications to the shortest duration necessary. Reducing acid reflux without compromising kidney health may require a combination of lifestyle adjustments and alternative treatments. Here are safer options and tips. 1. Lifestyle changes to manage acid reflux. Dietary adjustments. Avoid trigger foods such as spicy, acidic, or fatty meals. Eating smaller, more frequent meals and avoiding late-night snacking can also help reduce reflux symptoms. Weight management. Excess weight can increase pressure on the stomach, worsening acid reflux. Losing weight may significantly improve symptoms. Elevate your bed. Raising the head of your bed can prevent acid from flowing back into the esophagus while sleeping. 2. Use safer medications. Switch to H2 blockers. H2 blockers, such as famotidine, Pepcid, reduce stomach acid less aggressively than PPIs and have a lower risk of kidney-related side effects. They are often effective for mild to moderate reflux symptoms. Short-term PPI use. If PPIs are necessary, work with your doctor to use the lowest effective dose for the shortest possible duration. 3. Monitor kidney function. If long-term PPI use is unavoidable due to severe GERD or other conditions, regular kidney function tests can help detect early signs of kidney damage. Symptoms such as reduced urination, swelling, or fatigue should be reported to your healthcare provider immediately. 4. Explore natural remedies. Some natural options, such as ginger tea, chamomile, or baking soda, in small amounts, may provide relief from acid reflux without the risks associated with PPIs. Always consult a healthcare provider before trying alternative remedies. PPIs remain an important treatment option for managing severe acid reflux and related conditions, but their potential impact on kidney health highlights the need for caution. By exploring lifestyle changes, safer alternatives, and closely monitoring kidney function, individuals can reduce their risk of kidney damage while effectively managing reflux symptoms. Always consult a healthcare provider to determine the best course of action tailored to your health needs. Diuretics, commonly known as water pills, are a class of medications prescribed to manage conditions like high blood pressure, hypertension, heart failure, and edema, fluid retention. By promoting the removal of excess sodium and water through the urine, diuretics help reduce fluid buildup and lower blood pressure. However, while these medications are effective for these purposes, they can also put strain on the kidneys and lead to potential complications if not carefully managed. How diuretics affect the kidneys. Diuretics work by increasing urine output, which helps eliminate excess salt and water from the body. This is particularly helpful in conditions like hypertension, where reducing fluid buildup can lower blood pressure. However, diuretics can also cause dehydration, which can strain kidney function and potentially lead to kidney damage over time. Dehydration occurs when the body loses more fluids than it takes in, and diuretics can exacerbate this process by causing excessive urine production. As a result, the kidneys can become overwhelmed, leading to a reduction in their ability to filter waste and regulate fluid and electrolyte balance. This can lead to a condition called acute kidney injury, AKI, which, if left untreated, can progress to chronic kidney disease, CKD. In addition to dehydration, diuretics can cause electrolyte imbalances in the body, particularly with potassium levels. Certain diuretics, such as thiazide diuretics, egg hydrochlorothiazide, can lead to hypokalemia or low potassium levels, which can disrupt the heart's rhythm and impair kidney function. On the other hand, potassium-sparing diuretics, egg spironolactone, can lead to hyperkalemia or high potassium levels, which can also be harmful to the kidneys and other organs. Risks of diuretics for kidney health. Dehydration. Excessive water loss can reduce blood flow to the kidneys, impairing their ability to filter waste effectively. Chronic dehydration can contribute to kidney damage over time. Electrolyte imbalances. Imbalances in sodium, potassium, and other electrolytes can disrupt kidney function, potentially leading to kidney injury or worsening existing kidney conditions. Kidney strain. Long-term use of diuretics can place added stress on the kidneys, increasing the risk of developing chronic kidney disease, CKD. Tips for minimizing risks while taking diuretics. If you have been prescribed diuretics, it is essential to work closely with your healthcare provider to ensure you are using the medication safely and minimizing potential risks to your kidneys. Here are some tips to help protect kidney health while using diuretics. Monitor potassium levels. Diuretics can either increase or decrease potassium levels in the body, so it is crucial to have regular blood tests to monitor potassium and other electrolyte levels. For patients on thiazide diuretics, potassium supplementation may be recommended to prevent hypokalemia. For patients on potassium-sparing diuretics, monitoring potassium levels is important to prevent hyperkalemia. Stay hydrated. While diuretics promote water loss, it is essential to maintain proper hydration to prevent dehydration. Make sure to drink enough water throughout the day, as recommended by your doctor, to help support kidney function and avoid fluid imbalances. Avoid excessive salt intake. High sodium levels can counteract the effects of diuretics and worsen fluid retention. It is essential to follow a low-sodium diet, limiting processed foods and reducing salt in meals. Monitor kidney function regularly. If you're on diuretics, it's crucial to have regular kidney function tests, such as serum creatinine and glomerular filtration rate, GFR, to assess how well your kidneys are functioning. If kidney function begins to decline, adjustments to your medication regimen may be necessary. Follow medication instructions carefully. Take diuretics exactly as prescribed. Do not adjust your dosage without consulting your healthcare provider, as improper use can lead to dehydration or electrolyte imbalances. Consider potassium-rich foods or supplements under supervision. If you are on a thiazide diuretic that lowers potassium levels, you may need to consume potassium-rich foods such as bananas, spinach, and sweet potatoes. However, never self-prescribe potassium supplements without consulting your doctor, as excessive potassium can also harm the kidneys. Avoid alcohol and caffeine. Both alcohol and caffeine can lead to dehydration, which can further strain the kidneys when combined with diuretics. Limit or avoid these substances while taking diuretics. Regular checkups. Visit your doctor regularly for follow-up visits to monitor blood pressure, kidney function, and electrolyte levels. If you experience unusual symptoms such as dizziness, weakness, or leg cramps, notify your healthcare provider promptly, as these could be signs of electrolyte imbalances. Alternatives to diuretics. While diuretics are a common treatment for hypertension and edema, there are other options to explore if kidney health is a concern. Depending on your specific condition, your doctor may recommend lifestyle changes such as weight management to help reduce fluid retention and improve blood pressure, dietary changes like a low-sodium, heart-healthy diet to reduce fluid buildup and promote kidney health, other medications that may be less taxing on the kidneys, depending on your condition. Chemotherapy drugs, while essential for treating cancer, often come with a range of side effects that can impact various organs, including the kidneys. Medications like cisplatin are particularly nephrotoxic, meaning they can harm the kidneys as they work to filter out these potent substances from the bloodstream. Understanding the risks and preventive measures can help minimize kidney damage during cancer treatment. How chemotherapy drugs affect the kidneys. Chemotherapy drugs target rapidly dividing cells, which is essential for fighting cancer. However, this mechanism can also affect healthy cells in the kidneys, which play a crucial role in filtering toxins and waste products from the blood. The kidneys process chemotherapy agents, and their toxicity can lead to kidney injury or damage. Certain chemotherapy drugs, such as cisplatin, methotrexate, and ifosfamide, are known for their nephrotoxic properties. These drugs can damage kidney cells, nephrotoxicity. Cisplatin, for example, can cause direct injury to the tubular cells of the kidneys, impairing their ability to filter and reabsorb nutrients and fluids effectively. Disrupt electrolyte balance. Chemotherapy drugs can lead to imbalances in potassium, magnesium, and calcium levels, which are crucial for proper kidney and overall bodily function. Cause acute kidney injury, aka. Sudden kidney function decline can occur, especially if preventive measures are not taken. Increase the risk of chronic kidney disease, CKD. Repeated exposure to nephrotoxic agents may lead to long-term damage and reduced kidney function. Preventive measures for protecting the kidneys during chemotherapy. While chemotherapy-induced kidney damage is a concern, there are several strategies that patients and healthcare providers can use to reduce the risk. Hydration. Proper hydration before, during, and after chemotherapy sessions is critical to flushing out the drugs and reducing their concentration in the kidneys. Intravenous (IV) fluids are often administered alongside chemotherapy to maintain hydration levels and protect kidney function. Medications to protect the kidneys. Drugs such as amifostine may be prescribed to protect the kidneys from cisplatin-induced nephrotoxicity. Diuretics may be used to increase urine output and help clear the chemotherapy agents from the body more quickly. Dose adjustments. Based on individual kidney function and overall health, doctors may lower the chemotherapy dose or adjust the frequency to minimize the impact on the kidneys. Close monitoring. Regular monitoring of kidney function through blood tests, egg, serum creatinine, blood urea nitrogen, BUN, and estimated glomerular filtration rate, EGFR, and urine tests is essential. Early detection of any changes in kidney function allows for timely intervention and treatment adjustments. Electrolyte management. Monitoring and addressing electrolyte imbalances, such as low magnesium or potassium levels, can prevent complications and support kidney health during chemotherapy. Timing of chemotherapy cycles. Allowing sufficient time between chemotherapy cycles can help the kidneys recover and reduce cumulative toxicity. Lifestyle and dietary tips for kidney protection during chemotherapy. Patients undergoing chemotherapy can take additional steps to support kidney health. Stay hydrated. Drink plenty of water daily unless otherwise advised by your doctor. Limit salt and protein. Reducing sodium and protein intake can ease the burden on the kidneys. Avoid NSAIDs. Non-steroidal anti-inflammatory drugs like ibuprofen can increase the risk of kidney damage when combined with chemotherapy. Consume antioxidant-rich foods. Foods like berries, spinach, and nuts may help reduce oxidative stress on the kidneys. Importance of collaboration with healthcare providers. Patients undergoing chemotherapy should work closely with their healthcare team, including oncologists and nephrologists, to ensure their treatment plan minimizes kidney risks. Open communication about any changes in symptoms, such as swelling, decreased urine output, or fatigue, can lead to early intervention and better outcomes. Lithium. Widely used as a mood stabilizer for bipolar disorder and other mental health conditions, is highly effective but not without its risks. Among its potential side effects, long-term use of lithium has been associated with kidney damage, making regular monitoring and preventive measures essential for those taking this medication. How lithium impacts kidney health. Lithium exerts its therapeutic effects by influencing various neurotransmitters and ion transport systems in the brain. However, as it is processed by the kidneys, prolonged exposure can lead to lithium-induced nephrotoxicity, which may manifest as nephrogenic diabetes insipidus, NDI. a condition where the kidneys lose their ability to concentrate urine, leading to excessive thirst and urination. This is one of the most common side effects of lithium on kidney function. Chronic kidney disease, CKD. Long-term lithium use can result in structural and functional kidney damage, leading to a gradual decline in renal function over time. Acute kidney injury, AKI. In rare cases, lithium toxicity due to high blood levels can cause sudden kidney damage. Factors contributing to lithium-induced kidney damage. Several factors can increase the risk of lithium-related kidney problems, including long-term use. Patients on lithium for decades are at higher risk. High serum lithium levels. Maintaining therapeutic but not excessive lithium levels is crucial to minimize toxicity. Dehydration. Dehydration increases lithium concentration in the blood, intensifying its impact on the kidneys. Pre-existing kidney conditions. Patients with existing kidney problems are more vulnerable. The importance of regular monitoring. For individuals taking lithium, routine monitoring of kidney function is critical to catch potential issues early. Recommended tests include serum creatinine and estimated glomerular filtration rate, eGFR. These tests assess how well the kidneys are filtering waste. Lithium blood levels. Maintaining lithium levels within the therapeutic range, typically 0.6 to 1.2 mol/L, is essential to prevent toxicity. Urine concentration tests. To identify nephrogenic diabetes insipidus or other early signs of kidney impairment. Alternatives and adjustments. Patients concerned about lithium's impact on kidney health should discuss options with their healthcare provider. Possible strategies include exploring alternative medications. Other mood stabilizers, such as valproate or lamotrigine, may be viable options for some patients, depending on their medical history and symptoms. Reducing dosage. Adjusting lithium to the lowest effective dose can minimize its impact on the kidneys while maintaining mental health stability. Combination therapy. Combining lithium with other medications may allow for a lower dose, reducing toxicity risks. Lifestyle adjustments to protect kidney health. In addition to medical management, lifestyle changes can help reduce the risk of lithium-induced kidney damage. Stay hydrated. Drink plenty of water to prevent dehydration and maintain stable lithium levels. Avoid NSAIDs. Non-steroidal anti-inflammatory drugs like ibuprofen can increase lithium toxicity and strain the kidneys. Monitor sodium intake. Sodium levels affect lithium excretion. Maintaining a consistent sodium intake can help stabilize blood lithium levels. Limit alcohol and caffeine. Both can contribute to dehydration, which raises lithium concentration in the blood. Signs of lithium-induced kidney damage. Patients on lithium should watch for symptoms that might indicate kidney problems, such as excessive thirst and urination, signs of nephrogenic diabetes insipidus, swelling in the legs or feet, fatigue or difficulty concentrating, a noticeable decrease in urine output. Collaborating with healthcare providers. Managing bipolar disorder often requires a delicate balance between effective treatment and minimizing side effects. Regular communication with healthcare providers, including psychiatrists and nephrologists, is essential for patients taking lithium. Adjusting treatment plans as needed based on kidney function tests can help reduce risks while maintaining mental health stability. Over-the-counter supplements, often considered safe and beneficial, can sometimes pose hidden risks to kidney health. While these products are widely available and marketed as natural or harmless, certain supplements and vitamins can have a significant impact on kidney function, particularly for individuals with pre-existing kidney conditions or those prone to kidney damage. How over-the-counter supplements impact kidney health. Supplements can affect kidney function in various ways, depending on their ingredients and dosages. The kidneys filter and excrete waste products, including excess vitamins, minerals, and herbal compounds. High concentrations of certain substances can overwork the kidneys, leading to inflammation, toxicity, or long-term damage. Supplements and ingredients to watch out for: high-dose vitamin D. While vitamin D is essential for bone and immune health, excessive intake can lead to hypercalcemia, high calcium levels in the blood, which may result in kidney stones or calcification of kidney tissues. Oversupplementation is especially risky for individuals with chronic kidney disease, CKD, as their ability to regulate calcium and phosphorus is already compromised. Creatine. Popular among athletes and bodybuilders, creatine supplements can elevate creatinine levels in the blood, a marker often used to assess kidney function. While creatine itself doesn't directly harm healthy kidneys, individuals with existing kidney problems should use it cautiously or avoid it altogether. Herbal supplements. Certain herbs, such as aristolochic acid-containing plants, have been linked to kidney toxicity and even kidney failure. Others, like licorice root in high doses, can cause electrolyte imbalances that stress the kidneys. Herbal diuretics, often included in detox teas, can lead to dehydration and reduce kidney function over time. Protein powders. Excessive protein intake, often through protein powders, increases the workload on the kidneys as they process the byproducts of protein metabolism, such as urea. This can exacerbate issues in individuals with reduced kidney function. High-dose antioxidants, egg, vitamin C. Although antioxidants like vitamin C have health benefits, megadoses can lead to the formation of oxalate, which contributes to kidney stone development. Calcium supplements. Excessive calcium supplementation can increase the risk of kidney stones, especially in those with a history of stone formation or CKD. Risks of unregulated supplements. The supplement industry is not as strictly regulated as prescription medications, leading to potential risks. Inconsistent dosages. Labels may not accurately reflect the actual dosage of active ingredients, leading to unintentional overconsumption. Contaminants. Some supplements may contain heavy metals or harmful additives that strain the kidneys. Lack of clinical testing. Many supplements lack rigorous scientific studies to confirm their safety, particularly for individuals with kidney concerns. Tips for choosing supplements safely. Consult a healthcare provider. Always discuss any supplements with your doctor or a registered dietitian, particularly if you have kidney disease or are taking medications that could interact with the supplement. Avoid high-dose products. Stick to recommended daily allowances, RDAs, for vitamins and minerals unless specifically advised by a healthcare professional. Choose reputable brands. Look for supplements certified by third-party organizations like NSF International or USP, United States Pharmacopeia, which verify quality and safety. Monitor kidney health. If you are regularly taking supplements, ensure routine blood tests to monitor kidney function markers like creatinine, eGFR, and electrolyte levels. Stay hydrated. Proper hydration can help your kidneys process and excrete excess substances, reducing the risk of toxicity. Signs of kidney stress from supplements. Watch for symptoms that may indicate kidney problems, such as swelling in the hands, feet, or face, decreased urine output or changes in urine color, fatigue or confusion, pain in the lower back or sides. If you experience any of these symptoms, discontinue the supplement and consult your healthcare provider immediately. The importance of moderation and education. Supplements can provide valuable health benefits when used appropriately, but it's essential to understand their potential risks, particularly for kidney health. For individuals with CKD, a history of kidney stones, or other risk factors, careful selection and moderation are key. By being informed, consulting with healthcare professionals, and choosing reputable products, you can safely incorporate supplements into your routine while protecting your kidneys. Always remember that more isn't necessarily better when it comes to supplementation. Protecting kidney health requires a proactive approach, especially if you're taking medications that could potentially impact kidney function. By combining careful medication management with lifestyle adjustments, you can significantly reduce the risk of kidney damage and support overall well-being. Here are some complementary tips to keep your kidneys healthy and functioning optimally. Stay hydrated. Proper hydration is essential for kidney health. Drinking enough water helps your kidneys flush out toxins and waste products more effectively. Dehydration, on the other hand, can exacerbate kidney strain and lead to complications like kidney stones. Aim to drink 8 to 10 cups of water daily, unless advised otherwise by a healthcare professional. If you're on diuretics or have a condition like heart failure, consult your doctor for tailored hydration recommendations. Monitor blood pressure and blood sugar levels. Both high blood pressure and diabetes are major contributors to kidney damage. Keeping these conditions under control is critical for protecting your kidneys from further harm. Blood pressure. Maintain a target blood pressure below 120/80 millimeters if possible. Reduce sodium intake, exercise regularly, and adhere to any prescribed medications. Blood sugar. For those with diabetes, aim for stable blood sugar levels by following a balanced diet, monitoring glucose regularly, and using insulin or medications as directed. Discuss kidney-friendly alternatives with your doctor. If you're taking medications known to impact kidney function, talk to your doctor about safer alternatives or adjusted dosages. Healthcare providers can often suggest less harmful options or strategies to minimize risks. For example, instead of long-term use of NSAIDs, explore non-pharmacological pain relief options like physical therapy or acupuncture. If you're on a medication like lithium, ensure regular kidney function testing and discuss possible alternatives if any issues arise. Limit alcohol consumption. Excessive alcohol consumption can impair kidney function over time, as alcohol dehydrates the body and puts stress on the kidneys. Moderation is key. Limit yourself to 1 drink per day for women and 2 for men, or avoid alcohol entirely if you have existing kidney concerns. Avoid smoking. Smoking reduces blood flow to the kidneys, which can accelerate damage and exacerbate conditions like high blood pressure and diabetes. Quitting smoking is one of the most impactful changes you can make for kidney health. Seek support through cessation programs, nicotine replacement therapies, or counseling to help break the habit. Maintain a kidney-friendly diet. A balanced diet rich in kidney-friendly foods can help reduce inflammation and oxidative stress, which are key factors in kidney damage. Focus on low-sodium foods. Reduce processed foods and salty snacks to minimize fluid retention and blood pressure spikes. Antioxidant-rich foods. Incorporate berries, leafy greens, and cruciferous vegetables to protect kidney cells from damage. Controlled protein intake. Avoid excessive protein, especially from red meat, as it can increase the kidney's workload. Stay active and manage stress. Physical activity improves circulation, supports healthy blood pressure, and reduces stress, all of which benefit kidney health. Regular exercise can also help prevent chronic conditions like diabetes and hypertension. Aim for at least 30 minutes of moderate exercise, such as walking or swimming, most days of the week. Practice stress reduction techniques like meditation, deep breathing, or yoga to prevent cortisol spikes, which can strain the kidneys over time. Monitor kidney health regularly. If you're at risk for kidney issues or taking medications that affect the kidneys, schedule routine checkups with your doctor. Regular blood tests and urine analysis can detect problems early, allowing for timely interventions. Track key markers like creatinine levels, glomerular filtration rate, GFR, and protein in urine to monitor kidney function. Limit over-the-counter medications. Be cautious about using over-the-counter painkillers, antacids, or supplements without consulting your doctor. Even seemingly harmless products can contribute to kidney damage when used improperly. By incorporating these habits into your routine, you can significantly reduce the risk of kidney damage while continuing necessary treatments. Taking a holistic approach that combines medication safety with lifestyle changes is the key to maintaining strong and healthy kidneys for years to come. Understanding the potential risks of medications for kidney health can be challenging, but addressing common concerns can help you make informed decisions. Here are answers to frequently asked questions about medications and their impact on kidney function. Are these medications safe in small doses? In most cases, medications like NSAIDs, antibiotics, or proton pump inhibitors, PPIs, are safe when used as prescribed and for short durations. Problems typically arise with long-term use, high doses, or when they are taken without medical supervision. Key tip: always follow the dosage instructions provided by your doctor or pharmacist. Avoid self-medicating or exceeding recommended amounts. If you have pre-existing kidney issues, consult your healthcare provider before taking any new medication, even over-the-counter drugs, as they may require adjustments or alternatives. What signs should I watch for if my kidneys are affected? Kidney damage can develop gradually and may not present symptoms in the early stages. However, it's important to be vigilant about the following signs: swelling, puffiness in the face, hands, or feet due to fluid retention; fatigue, a lack of energy caused by a buildup of waste products in the blood; changes in urination, decreased output, dark-colored urine, or foaminess, indicating protein in the urine; high blood pressure. Persistent hypertension can indicate stressed kidneys; lower back pain, discomfort or pain around the kidneys could signal a problem. Action: if you experience any of these symptoms, seek medical attention promptly for proper diagnosis and treatment. Can kidney damage from medications be reversed? In some cases, early-stage kidney damage caused by medications can be managed or even reversed by discontinuing the harmful drug and adopting supportive treatments. However, once kidney damage progresses to chronic kidney disease, CKD, or failure, it becomes much harder to reverse. Steps to take: stop the medication under your doctor's guidance. Implement kidney-friendly lifestyle changes, such as staying hydrated, eating a low-sodium diet, and managing blood pressure. Use medications or supplements that support kidney function as prescribed by your doctor. Prevention is key. Regular monitoring of kidney function through blood tests and urine analysis is crucial, especially if you're on long-term medication that may impact kidney health. Understanding these common concerns and taking proactive measures can help you protect your kidneys while managing your health effectively. Always communicate openly with your healthcare provider to ensure you're making the best choices for your overall well-being. Your kidneys are vital to your overall health, and understanding the potential risks of certain medications is a crucial step in protecting them. We've covered 7 common medications that could harm your kidneys, from NSAIDs to over-the-counter supplements. While these drugs can be helpful for managing various conditions, their impact on kidney health underscores the importance of careful use and regular monitoring. If you're taking any of the medications we discussed, don't panic, but do take action. Consult your doctor before making any changes to your routine and ask about alternatives or strategies to minimize risks. Staying informed, hydrated, and proactive can make a significant difference in your kidney health. Remember, your health journey is about balance and informed choices. If you found this video helpful, please give it a thumbs up, share your thoughts or questions in the comments below, and subscribe to our channel for more health tips and insights. Together, we can prioritize kidney health and empower each other to make the best decisions for a long and healthy life. Stay well.